everybody. My name's Aaron Cohen. I'm the co-founder, managing director here at BWG Connect. We're a giant networking knowledge sharing group of thousands of organizations, and we do exactly that. We network and knowledge share to stay on top of newest trends, strategies, pain points, whatever it might be that's shaping the digital landscape as a whole. And when the same topics come up over and over again, we host an event like this. Spend a lot of my time talking to organizations individually about what those pain points are. And so super excited for today. We got some longtime friends over at Global Prairie. And he's brought in a lot of his longtime friends as well to have a really candid conversation around, what we kind of titled the Behavioral Health Balancing Act, right? And the digital marketing, the strategies that go along with it. So highly relevant to today and what's going on across the landscape here. And so just super excited for the conversation. A couple housekeeping items. If you'd like us to ask any questions, just drop them in the chat, drop them in the Q&A real time. We will get them answered. We'll just blend them right into the conversation as a whole. The other thing is we're starting here 3 to 4 minutes after the hour, and we're going to wrap up with 3 to 4 minutes to go as well. So if you're looking at your watch, just know we'll give you enough time to get on to your next meeting and grab a cup of coffee along the way. So I always like to kind of put those borders on it. But Tom, I'm going to kick it off to you. You guys have been great friends and supporters of a ton of people in the network, and really appreciate you guys and the team over at Global Prairie. If you want to jump in, a brief intro on yourself and the organization, that'd be great. And then maybe we go round robin here for a conversation. Sound good?
That's great. Thanks, Aaron. And I'm excited to be here with the panelists. An interesting topic in terms of how we'll discuss behavioral health services and how to kind of market and communicate in that space. But I'm Tom Hileman with Global Prairie. We focus on the health and life science industries. So we're extensively with providers, large health systems like Cleveland Clinic, Vanderbilt, and Baylor, as well as other health technology and health organizations across the spectrum. So we help them with their marketing and communication needs to reach patients and providers. So really look forward to the conversation, and I'll pass it to you, Len.
How you doing, everybody? My name is Len Matty. I head up the digital team at a for-profit publicly traded business called Universal Health Services. We're located here in southeastern Pennsylvania. My responsibility is in charge of all of our digital marketing, media planning, and website management for all of our facilities. We have approximately 330 behavioral health facilities spread out across 39 different states. Pass to Chris.
Well, thank you, Len, and really appreciate the opportunity to be here, and even the fact that we're having this conversation. I feel like behavioral health has been an overly buried issue until some very unfortunate events made it such that we couldn't keep ignoring the problem. I work at a company called Woebot Health, so I represent kind of the technology app side of this conversation, which it's an application that allows people to chat about challenges that they're having 24/7 in an automated manner. My role is in healthcare data science for the company. So I'll cover an angle that covers things like mental health engagement and things of that nature, but also from a health equity perspective. Also wanted to highlight, I'm a fellow of the NYU McSilver Institute for Poverty Policy Research. So a lot of the thinking and work that they do kind of infuses the work that goes back into Woebot. With that, I will pass it to Paul.
Thank you, Chris. Yeah, it's great to be here with you all. I'm looking forward to the conversation. I think this is definitely a complex issue for sure. So I was thrilled to be invited. So I'm Paul Wood. I'm head of communications and marketing at an organization called Cohen Veterans Network. We're a nonprofit organization that is really focused on serving post 9/11 veterans, their families, and actually active duty service members by providing mental health services and case management services. And so these are generally mild to moderate conditions. Our typical clients are with us from 8 to 10 sessions, and we are heavily located in the places where our large military installations are and our large populations of veterans are. So turn it back to you, Aaron.
Yeah, so just a quick reminder, everybody, if you have questions as we go throughout the conversation, just drop them in the chat, drop them in the Q&A. We'll kind of answer them real time. We'll just weave them into the conversation. So don't hesitate to do that. I kind of want to start off the conversation, and we can go around to each of the panelists here. As we look at this space as a whole, the marketing around it and the digital strategies, it's been, it's never been more complex than it is right now. And the balancing act, which we kind of built in there around, communication, around compliance, around the different tools or strategies or pain points that people have to use is incredibly relevant. I don't, Len, I might kick it off with you and we can kind of go around the horn, but like, when you look at this as a whole, like what are some of those challenges around compliance and or strategies that you have? And then we'll just kind of roll with the conversation.
Yeah, thank you. And I would say one of the first things comes to mind, and we're dealing with it every day, is as a marketer, which is what I would call myself. I would say you have to really understand your tech stack, right? Because as you think about compliance, as you think about privacy, as you think about what's been happening in our industry, it's not just an IT issue, right? It's not just a digital marketer issue. It's a marketing thing, and you have to really be cognizant of what technology you have in place. What are you evaluating? What agreements do you have in place for that technology? What kind of data is being collected through that technology? Where is it being stored? How is it encrypted, et cetera? So all of those types of things are compliance related, but it's not really marketing, right? So it's like, it's not that act of how do I craft a campaign and catch the eyeballs and get the clicks. It's more around the backside of things about that technology and where is data stored and how am I using it? And, do I have certain agreements in place? So it's complicated things for those of us in the space, right? Who may have been used to, running a Google pay-per-click campaign in a certain way all these years. Now we have to think about it differently, and or how we evaluate things with analytics platforms, right? That's a whole new ballgame now. So that's the first thing I would say, Aaron, is that it's really, as a marketer, whether you're come from a traditional marketing background, a digital marketing background, a comms background, compliance to me means understanding your tech stack and seeking out help internally or externally if you don't.
I'll jump in a little bit. I mean,
Yeah.
Len, you're right? The world of with OCR and the HHS guidance and all the compliance that's come down across the industry and as a whole, and anyone, of course, in healthcare, and specifically if you're doing behavioral health, it's even, I think, more important given the stigma and given the complexities of that. I've never spent more time in the last year than I have with compliance officers and legal departments as a marketer, right?
Yeah.
And
Yeah.
explaining how the internet works, which is always fun, and how pixel tracking and all the different techniques are. But I agree. I mean, I think, Aaron, Len, you really have to understand how it's all put together now. Because
Right.
if you don't, it's very easy to not be in compliance. And then there's compliance for compliance sake, but there's also compliance for real privacy sake, right? And I believe as marketers, we have a great deal of trust from our customers or prospective customers, and we need to do the right thing to maintain that trust as a brand. I know, Paul, given what you all do and the trust that people put in your organization to help them, I'm sure this is top of mind for you as well.
It definitely is, and kind of building on what you and Len have said, some of the frustrating parts are you think you might, really understand your tech stack, but then there are things that are literally out of your control that if you're going to advertise on partners like Meta, right, that they still have the ability to track your clients, even if you're not, or your prospective clients, even if you're not tracked, right, when they leave your site. So it's definitely become much more complex, even in the last 6 months, I think. And I spend a lot of time with our chief technology officer and also our legal team to kind of navigate, like with consistency, things like privacy policy based on what's happening with those providers and vendors.
I imagine it has to have drastically changed your evaluation of new tech partners as well. Right?
It does. It's a whole new filter, right?
Yeah.
I mean, BA versus non-BA providers, right? So business associates agreements to translate that a little bit. But yeah, and Aaron, it puts a whole new lens on it, right? It becomes something that used to be a box that you had to check to make sure you're doing the right thing is now usually the first box. And unfortunately, sometimes we have to trade off the ability as marketers to track effectively, not from a non-compliance perspective or anything nefarious, but as marketers, we always want to optimize and personalize the experience. And sometimes we're not able to, as Paul alluded to do that as much as we'd like because there may be platforms or approaches we cannot use anymore. So specifically adding then moving into behavioral health, it even makes it even more challenging.
Yeah, and it seems like there's a rapid advancement in the scope that we're having to focus on, but we also need to keep an eye on, as we partner with vendors, who has their eye on where compliance will go, because a lot of what is like static communications right now might over the next couple of years fall under the purview of generative algorithms and such. So it's important to also to make sure that that who we're partnering with has sufficient standards in how they're protecting the data that goes into that, how they're protecting and how they're guaranteeing that communications that come out of those types of systems are safe.
I wanted to get to like the HIPAA side of things, but before I get there, something that I'm talking to organizations outside the healthcare space, there was this huge influx of all this different tech providers that were out there that were almost like muddying the waters. And now as the PEVC money has started to like dry up, we see some like new ones that are more critical. Like if you found it over the past few years, just like way too many people to wade through. And are you seeing any changes on that front where most of the providers you're talking to, do have that kind of, Chris, what you're saying, that forward looking, hey, we're here to stay, and therefore we're considering the long-term future of where we need to be on a compliance standpoint?
Yeah, and I could take that one. I would tell you, I've seen all the above, right? There's new players that those of us are kind of on the provider side are watching to find out, is anybody working with them yet? Right? Like, who do we know is already partnered with that technology vendor? Has anybody? Are they just discussions at this point? And then you have the other part, which honestly, being in this business, you're not in this business unless you care about it. Like, I know Chris cares about it, right? Chris, of all the folks I've met through the years, Chris cares about this business, being in this business, helping folks, right? But then when you're getting into some of these conversations, it doesn't become about that anymore. It becomes about, the price, the technology, the contracts, and that you can get lost in that, right? And I think that that's an important thing to for everybody on the call to process, is finding the right type of partner, both technology and kind of that account management side of things as well, right? You really need somebody to come alongside you and talk to you about what's happening, not just sell you all the time. Right? Because if you're constantly only being sold to, then you're making decisions for different reasons and at different times. You know what I mean? And Tom, you know what I'm talking about. You deal with all of your clients all the time, and I'm sure they're talking to any number of folks, all of the time, and they come to you guys, and they need some help kind of filtering through some of the noise.
Yeah. No. Oh, go ahead, Chris.
Oh, I was just gonna say, I'm looking at the audience. I don't know who on here is from the vendor side, but like really take note on what Lynn is saying from that account management perspective, because sometimes organizations believe that all the technology parts are in place, but if the account manager is switching month to month, quarter to quarter, it creates such problems for things that require long-term vision to establish.
And to piggyback on that, I guess, Len, to go to the complexity, or Aaron asked the question. I think, according to Chief Martech, I think there's 10,000 plus Martech solutions. I don't know. I know a fraction of maybe 1% or 2% of them, and this is all we do, right? So there's bound to be consolidation, and I think some of this shakeout in the PEVC market is good, because we need to boil down some of these solutions to the ones that really provide value. But there is a lot of fear, uncertainty, and doubt being sold, and there's a lot of selling going on. There's not a lot of listening or being a trusted advisor. I think one of the key things that we do is help our health systems kind of understand what the options are, and we try to filter out some of the noise to say, these are the players that we think are most in line with your values, right? The mission of the organization, because that's critical in healthcare. I don't think anybody gets into healthcare unless you have some type of mission orientation to you. There's easier ways to make money than there is in healthcare. Healthcare is messy, it's complex, lots of compliance, right? So, but I think that's a key thing, is to listen, and then to be that trusted advisor to guide people along that. And like I said, there's a lot of selling going on, because now if you don't sell, you don't survive. And we're seeing a pretty frenetic marketplace.
Yeah, I'm hoping it shakes out. I think it will over the next 6 to 9 months pretty drastically. I do want to jump into some of the more strategic stuff, which are around, patient confidentiality, HIPAA. and yet trying to balance that with the marketing side of things and making sure you're having the right compliant communication with patients as a whole. I don't know who's the best to kick this one to first. Maybe Paul. Like, how do you think about that?
Happy to stay. Sorry. Yeah, I know we're going to get to stigma, but I think confidentiality and stigma are so huge in the military and veteran community, right? And that idea of trust, and trust is really around peer-to-peer trust, right? Who's gone to, for example, a Cohen clinic and okay, they had a good experience, I trust them. So yes. So we look at a lot of the ways how we can market on the ground and things like that. But in terms of the digital side, it's been very interesting. We made a decision to basically turn off things like retargeting, right? Like we just don't do that. And I'm sure many on the call may not as well, but for us, we ran scenarios in our minds, right, where it's often the spouse who is convincing the either service member or veteran to go get help because there have been things that happen. It could be DUI, could be anger at work, whatever it is. So it's often the spouse who's doing the research, right, who's in the Facebook groups and who's looking at websites and things like that. So the worst thing we think you could do is have that home laptop then targeted or retargeted. And so the service member is on and saying, why am I getting served ads about mental health? What's happening here, right? And is someone watching me and all of that stuff. So that's just a simple thing that we've made the decision not to do. So we have to find other solutions to be able to kind of keep in touch with those clients, including kind of the online, offline approaches.
Retargeting is a slippery slope. It's a highly effective tactic. Like in other settings, retargeting's returns are outstanding, probably maybe one of the best. Healthcare, though, is a dicey proposition at best, right? Specifically what we're talking about today, because you also have to choose, not beyond turning off retargeting, which I think is pretty much imperative in the world of behavioral health. Also your level of personalization. Because as marketers, we've always been driven to personalize, right? Make the message as targeted as we can for the person. But when it comes to behavioral health, that's not always the best thing, right? Because it can be seen as intrusive or not trustworthy, even though it's not necessarily that what we're trying to do in any way. But we have to really put ourselves in, crank our empathy up to a level 11 and kind of understand what people are going through and how would they feel if they saw those messages, right? And typically that means being a little more general if you're in a not logged in experience, right? Or if you've not identified yourself. So it's a really it changes the levers of what we typically do as marketers.
Yeah, and Tom, one of the things that my team's thought a lot about over the recent years is, you're right, personalization is in part of our conversations. We're thinking about behavioral health marketing or digital marketing. But what we can do is maybe replace personalization with ease of use or ease of access, right? How can we simplify the process? How can we eliminate a barrier, a step, find out where there's a pain point, a friction point in that digital process and see if we can make it easier. A simple example might be, in our business, a lot of folks want to talk to somebody on the phone, right? But they also do a lot of research and on their own online, of course. But sometimes you need to bridge those two things together, but you have to do it in an easy way. So sometimes we'll talk about online scheduling capabilities where you're not asking for a lot of information from the prospective patient. The process is simple and quick, but it gets them to the phone call, that assessment call, which is what they really want to have. So you eliminate the friction in trying to schedule that, make that part easy. And it's not personalized, right? It's just a couple of fields of information, but it gets them to the phone call where that obviously becomes personalized and personal, but it happened quickly, right? So at least as a marketer, we can think, okay, I couldn't personalize it. Yeah, retarget. We don't do retargeting either, right? We have not for a long, long time. And that's, but what we do think about is, how do I make that call to action stickier or more prominent or easier to get to, right? So that the person can roll through the process quicker.
Yeah, Chris, I see your head nodding a lot. Would love to hear your thoughts here as well.
Well, it's nodding out of genuine agreement, but I'm having to think from another perspective because I represent an application that while you're within the app, you're within the app, it's supposed to remember conversations in the past and tailor the tailor conversation that way. So it's not to say that it's not to say personalization outside of the app. I 100% agree on outside of app experiences, especially Tom, with the example that you gave of that being revealing to other users of that same machine or digital ecosystem. But even within the app, the like within the applications you may be evaluating, if the personalization is such that it assumes problems that a user may have, or it starts taking someone down a path without confirming, that's gone too far as well. It should always be an opt-in, invited, and confirmed from the user. This is a path that I want to go down, or this is a problem that I'm having. Let's go deeper.
Yeah, it's hitting me right now that the dichotomy that happens where ahead of time limited personalization, right? But then as soon as you pull them in, highly personalized needs to immediately take place. Which is what people are going to expect at that point in time. But also, Len, like what you were saying is because you can't be personalized, you might get that one shot and it's got to be as simple as possible to suck them into the system for everybody's benefit, including theirs, right? And then highly personalize it, like Chris, like you're saying, right? Like can't do this out there, but inside of it, we can.
Yeah, and I think, Paul, I know you have some interesting data that you've looked at, but not only for the first visit, but getting them back for the second visit, right? Engaging that experience. So, I mean, most of behavioral health isn't an acute service, right? These things are typically chronic or longer term. And so it's not like going into the urgent care and getting something filled and going about your day. These things take time, right? I know, Paul, that you've done a lot of research and a lot of work kind of understanding your usage patterns and how do you keep people in your system.
Yeah, thanks, Tom. That's right. Yeah, so building on my earlier comment of just say a girlfriend or spouse is encouraging, let's say Chris to call, right? And so he calls, he makes an appointment, does his first intake, which is like an initial evaluation, and then we schedule him for a biopsychosocial, so a much longer assessment, and then from there starts weekly therapy, right? So what we've noticed is that there's a good chunk of people who will drop out in between the first and the second evaluation, up to maybe even 25% on average, which I've heard is not unusual in behavioral health. But I feel like part of that is people saying, yep, I called, right? I talked to them, I feel better, I'm good, right? So it's very complex. And then there are other really noticeable dropout periods that we study. And so some of the thinking that we're doing now is, could you have select touch points at key parts of the journey? Like, for example, after session 3, when you're in weekly therapy, there tend to be people start to feel better. So, say, I'm good, I'm done. But we know if people complete their treatment plans, they have much better longer term outcomes. So what can we do now that we have permission, obviously, because it's their client, now that we have permission to touch, have a touch point with them to kind of encourage them to stay in care. So we haven't activated on that portion yet, but those are the things we think about.
When you were just mentioning, like, I'm thinking of like patient consent side of things, right? Mm-hmm. Like, how do you think about the marketing materials? Once they're in the program, you have to follow up, right? But you still have HIPAA, you have to respect them as a whole, right? They're
absolutely. Yeah, well,
it's gotta be like a careful balance, right? Like, and this I know is specific to what we're talking about to behavioral health, but it applies outside as well. But it's just much more meaningful, I think, in this area.
Yeah, absolutely. And so that's around people consent, yes, at intake. Mm-hmm. But also it's, what communication do you prefer? And can we leave a voicemail? And some of those things. So I think that's probably pretty standard now, but obviously you don't want to be texting someone if they've not agreed to that, consent, or even appointment reminders or anything else. So yeah, that's important.
Yeah. Well, then I can see you nodding your head. Would love to hear your thoughts here too.
Well, and I think part of that kind of post-treatment or post-discharge process is, how can we on the provider side, and Paul, and we'd love to talk to you more about it, is, how do we connect them? How do we connect those patients with other folks, right? For instance, in our addiction treatment side of our business, substance use disorder treatment, we're oftentimes connecting folks in an alumni way, right? Where they've gone through treatment, there's other folks that have been through that same treatment at the same facility. How can we connect them? And, the numbers are out there astonishing just in terms of the level of engagement inside of that community, right? It's obviously a smaller community, but it's a community that inherently has ways in which to connect with each other. And we as marketers try to think of ways to help make those connections. So as you kind of, it's kind of a different level of consent, Aaron, to your point earlier, right? Where now you're saying, okay, you came in as a patient where we've established your communication preferences, but then above and beyond all that, what if we connect you to this group, right? That we vetted, that we know, that we're a part of as providers, right? And then what we've seen is the engagement levels go through the roof. And then people are more willing, at least, or to consider coming back should they need to, right? Because they're already staying part of that community. And that community could be mobile, right? It could be mobile app specific, right? That could be their only touch point, just a mobile app, but it works.
Yeah, I think that's spot on. And just one add is that in each of these clinics, we have what we call our community room, and it's designed to literally be a resource to the communities we serve. So if other nonprofits, other groups want to come and host their monthly meeting in our community room, great, right? So we're trying to that feel of just make it part of the community. But you're right, we have ongoing events every month. How could we leverage those to keep in touch with our alumni, if you will?
Right.
I just
I
want
know
to jump
that
in.
you,
I
Chris, I
just
know
want to
that
remind others, if you have questions along the way, like just drop them in the chat or the Q&A. We'll blend them into the conversation. So yeah, Tom, I'll kick it back over to you.
I was going to say, Chris, I know you measure engagement. I mean, your tool was kind of an interactive chatbot approach, and then you measured that engagement. I know we had a conversation about how you liken that to a person-to-person measurement of kind of that therapist connection. So I don't know if you want to talk about that a little bit. I think that's pretty interesting the way you all look at that.
Oh, yeah. Thank you for the shout out there. But yeah, one thing that we think is extremely important is that, well, I'll start off by saying about 70% of mental health issues are surfacing in a primary care setting. And that's where a lot of the prescribing and referrals come from. But there's a big barrier there where there's about a 50% adherence rate to therapy and things like that downstream for example, people that have depression. So we think about what some of those barriers to engagement are. It's extremely difficult to find that time to travel or book the online appointment to have a therapist. Paul, earlier you touched on stigmatization, and I think that's also a huge drop off area as well. So the whole idea behind like having an app within the care ecosystem is to take into account all the barriers that might be preventing someone from getting to in-person care, and then having that as a step that people can use in between visits or until they're able to go like basically have an area that they can access with fewer barriers and hurdles to get the to get the response and feedback and guidance that they need.
Yeah, and you touched on it, Chris. I was just going to add that I'm a big fan of the Woebot app, and have experimented with it myself. I really see how it works and how powerful it can be. And we've had conversations about, hey, could we use a resource like that at some point for those in between session kind of tune-ups, if you will, or check-ins. And I really love the thinking of that, and I'm hopeful over time that's something that we can explore, because again, if we can keep people in their full treatment plan, the better that they are in the end, and something like a Woebot, I think could have powerful impact on them.
Not to become a commercial, but thank you for that feedback on us. And as part of like your commitment to serving veterans, I would love to have that conversation and talk about some conversations that are happening at other veterans institutions.
Great.
I want to keep right on Paul here because a question that comes in, can you share unique strategies you've employed to help combat the stigma around veterans, also promote understanding, through digital channels as a whole? So others, if you have questions, drop them in. But how do you dance around this? Because you don't want to dance around it. It's probably not the right terminology. How do you address it?
And that one for me, Aaron?
Yeah, I think so. We can kick it around as well, but just, I mean, you'd mentioned it a couple times
Yeah.
just at the beginning. Yep.
Yeah, so again, I think we're trying to normalize mental health care. I recently did a group of focus groups across the country, just trying to understand what do people look for in a mental health care provider and what are the barriers, right? And one of the biggest barriers was stigma throughout the whole military family. Snapshot: if someone goes to mental health care, and while this is changing, it's still there in the military. They're seen as weak, and they put them on what they call profile, so they can have their soldiers or airmen or whomever taken away from them for a period of time, and it can be very troubling. They can lose security clearances and other things. So it's very it's a sensitive approach you've got to take, and I know we'll probably talk about that topic later. But in terms of just stigma reduction, we do a lot in campaigns. So this is beyond our advertising campaign. For example, we had a survey that we ran with the Harris poll, where we basically polled a representative sample of Americans about how they view the military. So even questions like, do you think the majority of veterans have PTSD? Other just big misconceptions, right? To try and really set the record straight about what is a veteran, who are they, and how are they part of my community? And maybe I'm thinking about them the wrong way. And then on our website, we launched a poll. We called it the Military 101 Pop Quiz. So we invited people to come and basically take this short, reasonably short quiz about their knowledge of veterans and military service, and then obviously shared results with them, and then directed them to this campaign webpage around Military 101, things like that. So part of that is stigma reduction, and then we tackle it more head on too. Like, for example, April is the month of the military child, and military families move 3 to 5 times as much as all of us. And so there's a lot of pressure on the family, the spouse who's at home, the service members who may be deployed somewhere, and the kids. In fact, we just did, we're about to roll it out. We just did something with a military kid influencer group called Bloom, where they're talking about some of the challenges of what they deal with these deployments and other things. And then we have some of our clinicians kind of counsel them, and then there's small, brief video segments. So the hope is all of this will help to normalize the conversation.
Awesome.
If
Love
let me
it.
speak up with something personal. I just wanted to share that I grew up in a military family, and my mother, well, like when we're talking about stigmatization, I don't see my mom in the chat, but when we're talking about stigmatization, like that really just rang all the way through to her soul. Like when it came to any kind of mental health assessments or issues, she didn't want me to go and seek any kind of help because of the fear that we would be stigmatized or put on the various types of lists and restrictions that you were talking about. So I just wanted to commend the work to remove that resulting stigma.
Paul, one of the things I would add to that too, and thank you, Chris, for that, because so UHS has what we call a Patriot Support Program, and it's a specific program geared towards active military veterans, services provided at some of our facilities, but as we think about it, I should say, as we think about those folks, they are specifically military family, but at the end of the day, as marketers, we need to remember they're probably seeking out information much like the rest of us are, right? So to help with the stigma point, I just wanted to share, like, a lot of what we think about, we get down to the keyword level, just in terms of our content development and our SEO efforts, right? Because whether you're active military veteran, a non-military family member, but you're seeking care, you're probably taking some of the same steps as everybody else, right? How you look, how you search. And there's ways in which to do that that are not offensive. They're not in your face. They don't sell right away. It could just be content based. It could be article based. You know, there's ways to do it where you can provide information and maybe there is no, you know, direct call to action necessarily, right? Because maybe that's not the appropriate step in that article, but, you know, supplying that article, you know, helps. So I think, you know, that's oftentimes what, you know, what we're trying to battle too is, just from a marketing standpoint, how do we craft the right message, but do it in a way where people feel comfortable finding it, right? And they don't feel like we're pulling them through a specific path intentionally. We're just providing information in the channels in which they already use.
You
Yeah,
had me thinking
spot
about
on.
the marketing piece, and Tom, I'm going to kick this to you first, and jump in if there's other stuff as well. But I was thinking about the two sides of the communication, right? One is to the patient, but at the same time, this doesn't work without the actual like clinicians that are there, right? The actual, you know, people even on the front lines and in the offices, like those two things have to be aligned. The collaboration has to be there, the communication that has to be there. Tom, I just know you deal with a bunch of people in this space, and we can go around the horn as well, but what do you see like is working really well, or where things break down, like different strategies? Because all of that has is marketers, I think what we're communicating about the services we're going to provide has to align with what the services are going to actually be provided are. And so that you get that two-sided.
No, it's true. I mean, that you have to have the alignment of clinical and the marketing communications, right? Because we can't be marketing something differently than what the reality is, or you're going to have issues on, well, the uptake, and then obviously also perception of your brand in the marketplace. So I think that's a very extremely important first step, specifically in these more sensitive topic areas, right? And sensitive disease conditions, and they are diseases, right? Like that, we need to. The stigma is something that we need to work through as a society and understanding. But I think a couple things there. One, when we're working in these areas, we have clear clinical alignment up front, so we make sure that the folks who are the clinical leaders are in tune with what we're going to be, how we're going to be messaging and marketing this information out. Because we don't have alignment there, then we're going to have huge problems downstream. Second thing I think is where Len was going. I really think that content marketing in behavioral health, you have to be at a level 10. Like you really have to be smart about the content that you provide and making sure it's as unbiased and non kind of directive as possible. My experience is you need to let people explore a lot. And I think Len's pretty smart mapping it down to the keywords from the awareness, consideration, evaluation side of things. And I think the other thing that's missed a lot is the caregiver. So Aaron, you had pointed out the clinician and the patient, but caregivers, and 80% of, depending on which statistic you look at, but they all pretty much line up in the 70-80% level. 70-80% of all medical decisions are made by women. And they certainly only make up 51% of the population, right? So I think we needed to look at the caregiver aspect, whether that's a spouse, whether that's a parent or a child, depending upon the nature and the age of things. One of the most often overlooked audience is the caregiver, because caregivers are key for adherence and compliance, and candidly for getting a message through to someone who may be struggling to comprehend all those pieces, right? Just based on the nature of the condition. So I think you really need to think about it with a high degree of empathy, and then really hone your content marketing effectively, and keep it simple, but with lots of information, very factual.
Yeah, Tom, one word that comes to mind as I was listening to you explain that is personas, right? And as marketers, we oftentimes think, well, I have to develop my personas, right? Who are the people looking for care or looking to engage with our business, our facility? And you're right, it is the prospective patient, it is the caregiver, it's also the clinician, prospective provider, clinician, or referring physician, right? So, we talked about this before. I think that B2B side to our work can't be discounted or forgotten, right? Because you have to remember the providers and the clinicians, they're people too. They have preferences too. And so when you're thinking about, okay, how do I map out a journey, right? Well, when a clinician is involved, you got to remember that they too already have preconceived notions, perceptions, preferences that you have to factor in when you're developing that marketing plan, because perhaps they prefer to refer in a certain way to a certain type of organization, to a local partner, who all kinds of different variables. So really, you're right. The caregiver element is so smart to bring up, because that is a much wider audience. You have one patient, you could have multiple caregivers involved, right? Multiple family members, extended family members, right? And when you think of it that way, it can kind of balloon, right? So I think you hit it right on the head. Is once you kind of think through who those different personas are, then you can kind of get down to, okay, how do I tailor my content, tailor my campaigns, tailor my websites to help those personas?
If I jump in, kind of bringing us back to like the title as a whole, the balancing the innovation and compliance piece. I was wondering if we could go around and just like share a way, your organization as a whole has kind of effectively balanced that innovation along with compliance, in this, around behavioral health sector as a whole. I think that would be cool. So like type of innovation, impact you've seen, outcomes, KPIs, whatever it might be. I think that would be kind of fun too. So who should I kick it to first? Len, you want to go first?
Sure. Yeah. From an innovation standpoint, I think with an organization our scale, it's important to remember, you can't be the first one out the door, right? At least we don't take that role, right? We, as I was mentioning earlier, we tend to watch a little bit first, just as we're thinking about what else is happening in the space. As you're thinking about innovation, my guidance would be, don't rush to judgment just because it's innovative, it's cool, it's different, it's new, and there's a lot of talk about it, right? Remember that innovation is complicated oftentimes. So, and that complication, how you apply it to your business could be even further complicated and way different than the other person you just heard about talking about the same technology, right? So I think what we do from an innovation standpoint is we measure it, right? We measure, what do we know can help us right now? And then what can help us in 2 years, what can help us in 5 years? As we're evaluating our innovation roadmap, our technology stack, and all those things, that's what we're thinking about. We're not just trying to get to an endpoint. We're trying to get to milestone points through that journey, and taking a measured approach to do that, because you can have success all through that process, right? It's not just one single endpoint, one big celebratory party, like, oh, I innovated, I launched this thing, and now it's going to be great for the business. There's all kinds of wonderful success stories leading up to that point, right? So that's what we try to do. Specifically, I think what I would say is, we evaluate technology appropriately for our facilities, for our personnel, for the types of patients we serve, and we think about that each time. It's not the same. It can't be the same, right? So we process it differently each time, and yeah, it means our process might be slower, right? Our business may not be innovating, as quickly as some others, of course, but that's okay, right? Because what we're trying to do is innovate enough to help a patient, to lead to an appointment at one of our facilities. And I think at the end of the day, when you think about innovation in our space, behavioral health space, that's really what you need to be thinking about. Does the innovation actually help the patient get the care they need?
Awesome. Paul, you want to jump in? And then
Yeah, happy to. Yeah. So I think a couple things like guiding principles for us, and this really comes from our founder. In terms of innovation, it really relates to risk, right? And so there are two big buckets of risk. One is more around what we're calling entrepreneurial risk, right? So and one is around enterprise risk. So enterprise risk is bad. Entrepreneurial risk is good, right? In terms of, hey, we tried something, it didn't work out, we learned from it. That was a test and learn, no problem. That's entrepreneurial risk, right? Enterprise risk is we acquire some other organization or do something that's really not fitting with the mission. So in terms of some of those, I think, during COVID, we had this network built, and basically because we all went into kind of self-preservation mode, panic mode, everyone pulled back in the whole industry, right, on their healthcare appointments. So we were at a point at that time where we probably had 10, 15% of our appointments for telehealth. obviously everybody was set up, so it went up to 99% like everybody here. But we had this capacity of these clinicians. We didn't want to let go of anyone. We knew that it would come back. The need is going to be there more than ever. So one of our board members said, hey, you know, Elmhurst Hospital in Queens, New York is the epicenter, right, of the COVID crisis. Is there anything we could do for those healthcare providers? Could we offer them, say, groups and other things that they could do virtually to try and get through this period, right? So we quickly created and launched this service called CDN Frontline, got all the clinicians on board. We set up multiple kind of evening sessions by Zoom webinar, things like that. Zero uptake, right? Because everybody, they were in crisis. And at that point, it's funny, I had a meeting with that hospital CEO recently, totally about something different. And she said, oh, you know, at that point, we really could have used that. I wish you had called me directly. I'm like, oh, well, wah. But that's one where sometimes you're either just too early or you're trying something, right? I think the other one that we're exploring right now is we've been exploring AI. There's been a big rush, as you know. So one of the issues that we face is in documentation and making sure that we're up to date so that then we can kind of bill and do all those other things. So we actually explored various products in that area, and we determined that's not something we actually want to pursue at this time. So that one, again, didn't really invest time or too much money in that, just exploring it, and said, okay, no. So hope that's helpful.
Yeah, absolutely. Chris, jump in. Like this.
I know. I just always feel like sound like I'm pitching. But the main thing is that there's a big thought that I have is that innovation is often framed is mostly framed as a technology issue, but the more and more, like I've worked at a lot of institutions with some leading tech or predictive analytics or AI and everything like that, but innovation always rolls down to the people that will be delivering it and the patients that they're serving. So it's always going to be a question of, like, when you're evaluating what's out there, I believe that technology offers those people more choices, but when we're evaluating what's out there, we want to make sure that we're doing things for the right reasons. And when we think about these language models, chatbots, and applications that are able to communicate in such a nuanced way that they often confuse people into believing that they're human agents, that's a major issue of concern that we see and focus on, is to make sure that, like, as we're evaluating or considering what we deploy with the population, there's a slew of applications and things out there that might not have gone through any kind of FDA testing or evaluation that mimic humans and things like that. But there's always a path to look at the ethical grounding of the platform you're looking at, what the founders stand on, and hold them accountable to, hey, we want to make sure that we can understand why things are being applied to certain populations and evaluate these outputs, and even make sure that your program communicates exactly about what it is and doesn't try to mimic or pretend to replace nurses, physicians, etc.
Yeah, Chris, great point. Evaluating the output, right? I think that's so key. As marketers, there's so many tools now available to us. And Paul, thanks for bringing up the AI point, because I think all of us are either have been, are right now, or are thinking about how do we use AI to help us as marketers. And I'll just share something quickly, if I could, Aaron, is that, you know, what we realized is we're thinking about content development, right? Production, developing and producing information. You know, some AI tools won't actually be helpful. You think they might, but then, as Chris was saying, evaluating the output. I don't need a machine to craft a viewpoint that's clinical in nature that does not come from our providers, right? We think it's easy, it's quick, I can get it out, but actually that's not what we would have said, right? As clinicians. So there's other ways to think about AI. One of the ways in which we're doing it is with our own language model, right? Where we have information we have already put together, then leverage AI to help you. So in this case, a use case would be, you know, use an AI tool to develop a video that already uses the text that you've written, right? That's a way in which you can use AI to your benefit, where you're not asking it to write something new. You're just saying, hey, take this information I've already written, vetted, and run through compliance, and just frame it in a new way, add some stock photography and make it move. Right. And then boom, I got a social video. I can throw it on YouTube. I can add it to my website. And now I got content for somebody to find. And there was no risk. Right. So I think that's part of the AI world, is what us healthcare marketers are still trying to figure out and navigate towards.
I wanted to drop a funny example of what happens if you go wrong. This happened in the airline industry. Canadian Airlines, they set up a chat bot that allowed people to, it was a customer service chat bot, so people could ask questions about their tickets and things like that. And this person talked to the chat bot, and it heavily discounted the ticket in a way that that the airline wouldn't actually have approved of. So that went to court, and that could have gone in one of two ways. They could have ruled in favor of the airline that said, hey, this is a ridiculous offer, we never would have made that, but our chat bot did say it. Or they could have ruled in favor of the customer. And this is, we're talking about $700 here, but by ruling in favor of the customer and saying, hey, you're accountable for what happened, you're accountable and required to give them this discount, that sets a path and a precedent that, hey, the stuff that we're putting out there, it had better line up with our values and the things that we're going to offer. Silly little example, but big implications.
No, but it's awesome. And we're getting here to almost a time, but Tom, I want to kick it over to you. If you want to wrap us up, cool things you're seeing in this space. We did get to AI. It's right here at the end. I mean, you're working with so many great organizations, and you get pulled in, I know, on these tech talks, and the idea around, hey, help us vet these out. Like, what are you seeing in this space? And then like key takeaways. I don't know if we'll have time to go around the horn. But what, I mean, it's been a fun conversation. Like, what are you gathering and taking away from here? And what are some cool new tech that you're seeing that's out there?
Aaron, thanks for having me, and it's been a pleasure with the other panelists. I think in AI, I'm seeing there's two roads to take right now, or two paths. One is doing things more efficiently. I think that's where Len was going, with little risk, right? You can leverage these tools to generate content, protect your own information, and make sure that you have it all, and generate subject lines or generate short form copy or video. So there's a lot of advantage. Podcasts are another great way where AI can be scaled very quickly. So there's the efficiency play, which is, I think, I'd encourage everyone to be driving on, just because it gives you so much lift, especially for smaller organizations that don't have huge departments or huge budgets. These tools are inexpensive and they can be used in a very safe way. The second thing, which I think is more interesting, but more risky, more innovative, is to do new things, right? And one of the things that we're dabbling with right now is AI-powered personas, where we can take all of our customer knowledge and information about our targets and then create personas in whatever GPT you want, whether it's ChatGPT, Claude, it doesn't really matter, but creating that, and where you can actually test your messaging and marketing and advertising against these personas, so that you can essentially iterate your campaigns faster. So I think I'd encourage everybody to look at the efficiency play, but also don't forget about what are things you wish you could do, because personas before were largely things we put on the shelf or pictures we had on the wall that we consulted occasionally, but they weren't very lively or active, right? And I've heard that from many CMOs, that we can finally pull that. So I think that idea is thinking about being efficient, but also thinking about where can we innovate safely, especially in this space. This is a low risk to no risk space to innovate in, right? It has to be super proven before to get legs with that. But those are my general takeaways from what I heard today.
Yeah. Awesome. Well, we're right here at time. Thanks everybody for listening in here. Thanks, Len, Paul, Chris, Tom, and the team at Global Prairie. You guys are great friends and supporters of the network. With that, we're going to wrap up this webinar. Thanks again to all the panelists today. It's been a total blast. So everybody take care, stay safe. Look forward to having you at a future event. Thanks, everybody.
Thank you. Take care, guys.